Hey guys, what's up? My name is Llewellyn, and you're watching another episode of Finding Borders. Today's guest is someone rather significant. I won't get into it straight away, but I have listed all their details in the description box if you want to go and have a look at that today. Before we get into it, don't forget to like and subscribe to our channel. Every little bit helps. Thank you and enjoy the show.
Our guest this week is someone who has received the OBE award, the Order of British Excellence. They are the head of departments of histopathology, clinical director of pharmacy, pathology and genetics at Sheffield's Children's Hospital in the United Kingdom. Since 2018, they have been an honorary professor at the University of Sheffield, all because of personal matters, family background. They have had a friend that they met at a convention named Roc Kaschula, who recommended they become a trainee at the Red Cross Children's Hospital in South Africa. And fun fact, and she also lived in Cape Town for a little bit, just like my acquaintance Brendan over here. Man, look, we were out of our depth here today because medically I don't know anything about that field, and
we don't know squat.
Yeah, and you wanting to specialize in or have a look at medical negligence as well, you know, like it's somewhat up your alley, but I can't tell you anything about science, medicine, the works, man. I will
Absolutely. I think personally in this interview, I learned that I have much more to learn, a long way to go before I can even begin to fathom the world of medical negligence. And I think there was so much insight during this interview. It sheds a lot of light on some topics. There were some very interesting topics. And I definitely think this is by far one of the most distinguished guests we've had this far.
Yes, and I'll give a huge shout out now. We've had our previous guest, Pablo Andres Pera, who received the first vaccine, the AstraZeneca vaccine. He was in the first season. He put me in contact with her, and that made this whole interview possible, man. So without any further ado, my name is Llewellyn.
I am Brendan now, and you are listening to Finding Borders.
Roll intro.
Season 2, Episode 2.
Welcome to our show, Marta Cohen.
Thank you.
We're very excited to have you on here. We did a bunch of. First of all, you know, I can see here on my research, you've won the Order of the British Empire Award from Queen Elizabeth II. Is this correct?
Yes, I was. How can I say? So emotional when I received the call in 2020 May saying that from the cabinet office, a phone call saying that I have been awarded the Order of the British Empire for my work and research on sudden infant death. And I was, what? And they say, but you cannot tell anybody. I say, what? I cannot, I have to tell my family. And they say, okay, you can tell your family, but they were very pleased, very nice. But they say, you can, this is going to be made public at some point later in the year. Given the pandemic, it's not going to be public now. So you have to, please don't tell this, because this it will be announced by the sovereign. So it only happened on the 20th of October when it was made public. And that morning, I didn't know that when it was going to be made public. And I was actually sleeping in a mini holiday in Edinburgh, the first in all 2020 because of the pandemic. And I received a call from my chief executive saying, congratulations. And I said, what for? I didn't even know who was calling me. And it was my chief executive saying, congratulations, because it has been made public, that list of honors, and I was there. So yes.
Yes,
Very nice.
and I mean, I understand also at the moment, you're currently the head of the Department of Histopathology and the clinical director of pharmacy, pathology, and genetics at the
Yes, that's
Sheffield
correct.
Children's Hospital.
Yes,
Yes.
that's correct. That was one of the first hospitals in the UK, and it was started in 1876. 1876, and started with only a few beds in a house. And it was, can you imagine, 1876, a children's hospital with 5 beds. Incredible. And I have seen photos of the original hospital and all the nurses with very long dress. And it's such a coincidence, because I always think that life is like a puzzle. You know, you move one piece, you position the other piece, and then you move, and this is how your life gets going. And I come from a small town in Argentina called Trenquelauquen, which was founded in 1876. So you can see the difference.
Oh.
Yes, in 1876, the Spaniards have discovered America in the 1400s, but in 1876, they were already in Argentina, but they were conquering the Patagonia and the Pampas. And they were fighting the local indigenous people, the natives, that they were wanted to protect their territory. And these were fighting and getting more and more territory. So all my town started as a battlefield, because this is how they were founding towns, getting the town, getting secure there, and expanding and expanding. This is how the Spaniards did it. So I say the difference between in my country, they were fighting the natives, and in this country, they were developing a hospital for children. So big difference.
And that
is really, really cool. And now tell me, Doctor, turning back the clock a bit, the
Call me
National
Marta,
University of
please.
La Plata. Okay,
Call me
Marta.
Marta. Yeah.
Tell me, what motivated you in the beginning to go into pediatrics?
Okay. First of all, I should tell you why I went into medicine. Because my parents were the first pediatricians in town. So my dad is from Peru, and he was left orphan at the age of 8. So he didn't have mother, he didn't have father. He was raised by a grandmother, and at some point, you know, his life is very interesting. You should interview him, who is 100 years old now. And he made his way to Argentina to study medicine. He paid for his own career because he didn't have anybody to pay for him. So he has to work and study. Met my mom, who was from my area in Argentina, and they became the first pediatricians in the town. So I am the eldest of 4, so everybody was saying, you will be a doctor. And what is your response? No. You will be a doctor? No. So it was almost the end of my last year at secondary school, and I didn't know what on earth I was going to study. Because I wanted to study what it fascinated me, and I think I would love to have studied, is the geology of the sea. Marine geology, not biology, marine geology. What is it, the depth, of the oceans? What is the origin of that? You know, nobody has discovered that, but I say, no, I cannot live in a boat. I wanted to have a family as well. So I went into having a test, and the test, vocational test, came back with psychiatry and genetics and law. I said, okay, I'll do medicine. The good thing is that my mom say, don't worry, if you don't like it, you change. So I went with no pressure saying, you have to do this. And I went into medical school. And in my 3rd year medical school, because I am a pediatric pathologist, I'm not a pediatrician, I'm not a clinician. I make the diagnosis either with autopsy or with the tissues under the microscope, saying, which is this tumor, which is this disease. All the different diagnostics are made using tissues. And so I went into medicine in my third year medical school. A very good friend called Ricardo was next to me, and we were first time faced with a patient. And the patient, they start doing a test, and he starts screaming, and I collapse. So the reality is that I say, I cannot face patients, because it's very traumatic to me to face patients when there are, I know that the job I do, being a pathologist, is tough, because I have to make the diagnosis of this very unusual tumor, advanced stage, undifferentiated, etc., etc. But I always say, for the clinician, to tell the family or to tell the child or the teenager, unfortunately, the biopsy has come back and you have such a sad tumor, we will have to give chemo. And if the person or the child asks, or the family, what is the possibilities? What is the outcome? It's a high-risk tumor, or it may be a good outcome, but facing that is too emotional. I have come across parents and I end crying with parents, so it's not for me. So it was my third year medical school when I decided that I was already having pathology as one of the subjects, and I decided I'm not going to do clinics. I'm going to do pathology. So it was that made me the diagnosis, the choice. Then when I finished, I went into do pathology. I went to the University of Buenos Aires, because by that stage I was studying in La Plata, near Buenos Aires. Went to the University of Buenos Aires, did pathology, and then something happened. Two terrible things should happen. I don't know if I should tell you this. It's embarrassing. The reality is that my medical school and long-term boyfriend cheated on me.
Wow.
He was doing obstetrics and I was going to do pathology, and we were going to be working together. And when I discovered, I'm not going to go into how I discovered, but it was very interesting how I discovered. And I even have to set up a trap to discover him. I left him and I was, what I'm going to do. I had to go back to my hometown because there was no jobs for me in Buenos Aires and there was no perspective. And then Trenkelauken, my hometown, had a flood, terrible flood, like climate change, and it was very depressing. And I said, I cannot go back to Trenkelauken. I feel depressed. I was 25, 26. I was 26 and I felt very old. And I decided that there was only one thing else I could do, and is that to have a super specialization in pediatric pathology. So this is how I went into pediatric pathology, by chance. I told you, the life is a puzzle.
Absolutely beautiful story.
Yeah, I mean, I'm also aware that you are you're an honorary professor at the University of Sheffield since
Yes.
2018. So you practice medicine and you also lecture or teach
Yes.
medicine to university graduates.
Yes, I love teaching. I think that the thing that can save all of us is education.
Yes.
If you have education, you can access everything. And the difference is my dad. For instance, my dad, when he was born, I told you he lost his mom and he lost his dad or didn't have a dad. And he was teaching Spanish to the natives who spoke Quechua in Peru. And he didn't do secondary school. He did teaching the natives Spanish with primary school until his stepbrother said, no, you have to study. And then he went to secondary school and he went to Trenquelauque, Buenos Aires, studied, met my mom. And then he became a pediatrician, a director of the hospital, and he got more because he was educated. And I think that the thing I want to leave is education. So that's why I'm writing books, I'm writing papers. I have trainees from England, but I also receive people from South Africa, for instance. Sri Lanka, I have one that is from Sri Lanka, stay for a year. Then I have a lot of people coming from Poland, from Portugal, from Spain, from Argentina. We accept them. Philippines are coming as well, because my view is that our life is very short and that we have to leave a legacy. And that what I want to leave is education. Yeah.
Yeah, and I mean, I heard this. I forget who said it. Forgive me. But it says we die twice in our lives. We do once in body, when we pass on, and then the second time is when people forget your name.
Yes, absolutely. Yeah, absolutely. And I always say, obviously you need the money to survive, to have a good quality of life, to go to a deserved holiday, etc. But I'm not tough, try not to be tough with money, because I always say, you come to this world and you leave the world alone and naked. So you come, even if you are twins, you when you are born, it's just you, and you are naked. And when you die, even if you are dressed, you depart alone. You are the only one to experience your death. So, why to keep on the money and be greedy? So, yes. So it's very simple, I think.
Now, forwarding the clock a bit, in your journey as a career, how did you eventually end up at the Red Cross War Memorial Children's Hospital in Cape Town?
£10, $10 changed my life. My life changed for $10.
Wow.
It was Argentina, as you know, is always up and down with the economy, and it's always hyperinflation very frequently. And it was 1988. I was alone with no boyfriend, I told you. I was doing pediatric pathology. I was not happy in the hospital where I was, because I came from a very high standard hospital where people were there working very hard, to a hospital that didn't fulfill the expectations I had, put it that way. And there was an international conference in La Plata. So I decided to go. The dinner was $10, and my salary was $40 a month. Can you imagine I could pay for the dinner?
Wow, a quarter of your allowance. That's crazy.
Exactly, because it was a hyperinflation that moment. Once again, it's now again. So it's always cyclic. So I registered as a trainee for the conference, but I didn't for the dinner. And my mom, who was very wise, always said to me, go to the dinner in the conferences, because this is where you meet the people. So when I told her I wasn't going, she said, are you not going because of the $10, or are you not going because you are not interested? No, I'm not going because of the $10. So she sent me the $10, and I registered to the dinner. Next to me, there was a South African. They were all old people. I was the only young, because nobody could afford, only me, because my mother gave me. So next to me was Professor Roc Kaschula. And Roc was the head of the department and a professor from the University of Cape Town, who I didn't know he was going to become a very important person in my life, my mentor, my friend, my father in medicine. And Roc was sitting next to me, and I was asking him in my a bit broken English how he did find La Plata, had he make any shopping, and then he said he couldn't make any shopping because he didn't speak Spanish. I said, oh, I go with you next day, tomorrow. So next day, I went with him, I helped him, blah, blah, blah. And then I remember we were coming back in the middle of the big square in La Plata, Plaza San Martin, that is the name. He stopped, he looked at me and he said, I have a fellowship space or place or vacancy. Would you be interested? Of course, I said, yes, I would be interested. So that was September 1988. I met my husband in December 1988. In March, Roc letter arrived, or February. Roc letter arrived. No, in February, the letter arrived inviting me to the fellowship. My salary was going to be something like $2,000 a month. So it was a big difference for me.
Difference.
And also, you know, the expectation of being abroad. I have already traveled, but nothing like living abroad. And I remember those days we didn't have computers. It was a letter, handwritten letter, or you know, and very long with all the requirement for the registration, my duties, my expectation, what I should have, very, very well organized. And it was for 1 year with an option to 2 years if both parties were in agreement. At the end, I stayed 2 years. So we were both in agreement. So I should respond within a short period of time. By then I have met my husband. But I thought, if I'm going, if he doesn't want to come with me, I'm not going to stay for somebody who is not wanting to come with me. So I go anyway. So I then told him and invite him to come with me. And then he said, but we should marry. And we got married. And that's 32 years ago. Yes. So we married and we went together to South Africa. And I started working at the Red Cross War Memorial Children's Hospital. And Cape Town became my place, second home and a place in my heart, which I've been there a few times. I still collaborate with the University of Cape Town. I have supervised some of their PhD or been in the examiners panels, etc. I've been attending conferences there. So yes, it's a fantastic, beautiful place. And this is how, but I tell you more about the puzzle of my life, because that I left South Africa in 1992. We had a son with a very severe learning disability that was born there. So my life changed, had a very drastic change from being, you know, a just married couple to have a son with severe learning disabilities and with a genetic condition that we didn't know the name. Now we know the name. Okay. It's called Wolff-Hirschhorn syndrome. It's very severe. It's very complex. So I had the option to go to work in Canada. That Roc has put me in contact with somebody from Canada. I say, no, I cannot go. I have to solve this issue first. The issue was my son and the lack of diagnosis. So we went back to Argentina. But then Roc, I remember saying, if you ever go to England, go to Sheffield. Because Sheffield is a very friendly place. And that happened 10 years before I moved to Sheffield. And it's amazing, no? Because when I came to Sheffield in 2003, and I met the chief executive, in the wall was the picture, the photo of the Red Cross War Memorial Children's Hospital, because they were twin hospitals. So this hospital, I don't know if it still is, but it used to be a twin hospital with a Cape Town. So another part of the puzzle that I discovered.
Yeah, I said to, we spoke to another Argentinian guest, Pablo. You know Pablo
Yes.
very well, actually. And he was saying something similar, how life has these pieces, or how you can narrate the story of life, because Pablo writes as well. So he he should see be able to see the patterns and find a story and a narration out of something that you can present to people. But what I find also very interesting is was there an incident, I was reading about this, was there an incident where Scotland Yard involved with you for defending non-accidental injury cases? Was there
cases where non-accidental injury were allegations of? Yes.
Well, do you mind explaining further what happened?
No.
Because I understand very little about it, and I'd hate to come across as presenting dogmatism, because I would love to hear your side of the story.
Yes.
Clarity.
What happened is I'm a person of science. I'm not involved in politics, and I have an open mind.
Yes.
I always think that you have to be creative. You have to think out of the box.
Yes.
That things are not how you see them.
Okay.
Things are how they are, but you may not see what they are because you have a bias. So in 2000 and maybe in 2000, I arrived here in 2003. Sometimes in this decade, between 2006, maybe 2005, I think it was, there was a theory of Professor Guedes, very well-known neuropathologist, who she said that the triad of cases where a child collapses, is an infant, usually less than 6 months of age. It collapses, and when the child is resuscitated, it's found with a triad of hemorrhages in the brain, called subdural, hemorrhages in the back of the eyes, called retinal hemorrhages, and a swollen brain, called encephalopathy.
Okay.
So it's always the child with 1 or 2 adults who are the carers, because it's an infant, so usually are parents or a family or a close relative. The child collapses, the child is resuscitated, and the child comes back with this triad. So the diagnosis is, by default, non-accidental injury. Saying this is because they shook the child very, very strongly in anger, and the child develops the triad because they break very tiny bridging veins in the brain that are between the brain and the skull, and in this acceleration deceleration movements, and the child dies, and there is shaking baby syndrome. That's why they call it shaking baby. I never pay much attention to that, only that yes, shaking baby, this ABC, until I got involved with, the reason I'm here is because another Argentinian married to a South African who I met in Argentina. And she's also a pediatric pathologist, Dr. Irene Scheinberg. And she was working with this Professor Guedes. So she obviously is a person who has a very open mind. And she, led me to this kind of discussions in scientific papers about the theory from Professor Guedes. That was that actually the babies that become with lack of oxygen for any reason some may develop a swollen brain, raised intracranial pressure, hemorrhages in the back of the eyes, and thin film bleeding in the brain, so the triad. But actually, it's because the child has been under an episode of hypoxia, lack of oxygen. So I went into this, and then there was a paper presented by an Australian, Professor Roger Bayard, who say, lack of evidence of subdural hemorrhage associated with hypoxia. Then Irene and me, we look into our cases of fetuses and newborns, and we wrote a paper saying evidence of hypoxia associated to subdural hemorrhage. So we started in this kind of scientific discussion with Professor Bayard, who I respect very highly. And he never say anything because it is all scientific. So we were fine, and I was fine in the science kind of pathway. But this went into the courts. And it was another doctor, it was Irene, it was me, and it was another doctor called Wayne Squire, who is a very, very well-known pediatric neuropathologist in Oxford. She's retired now, but she has been one of the people diagnosed with shaking baby. And she then realized, no, this is a dogma, this is not as it. It can be the mechanism of hypoxia. So I was then asked to provide evidence for the defense and act for the defense in cases of shaking baby cases. And there was one case particularly in which it was a mother who was Muslim, who didn't speak English, who had a 2-year-old healthy and a baby. This mother was alone, the baby collapsed. She tried to resuscitate the baby. Obviously, they always give a bit of shake to resuscitate the baby. Called the brother, the husband, a driver in London, was driving the bus, and the driver, and he called the brother. The brother came to the house and then called the ambulance. So 50 minutes, baby has been down. When that baby was resuscitated, the baby had a child. So this mother was accused of murdering the baby. And I acted for the defense, and I gave my account. Actually, when you have lack of oxygen for any natural cause, or because of trauma, because if you shake a baby or you impact the baby and you cause hypoxia, you can also cause the same. But shouldn't be the default diagnosis, because we have explanation for natural causes of death. And there was no mark on the head to point to the impact. So the mother shook the baby and impacted the head. And the judge, that was a lady judge, family court, said, but don't you think, Dr. Cohen, that the mother shook the head and impacted the head in a soft surface, like a sofa or a mattress, not to leave a mark? And I say, yes, it is possible, but I doubt that the mother, in a moment of anger, she doesn't even speak English, would be looking for a soft surface, like a sofa or a mattress, not to leave a mark. I think that this is crazy. So that's it. Then Scotland Yard referred me to the GMC. My license was put at risk. And it's because the judge, in her summary, obviously found the mother guilty. The judge, the family court, who I think she couldn't be, they removed this child from her mother, the surviving child, said that this mother has shook the baby and has impacted the head against a mattress or a sofa, not to leave, and that's why there was no mark. And the Dr. Cohen is dogmatic. So I was just dogmatic. That's why I was referred. But I wonder who is more dogmatic, me or the judge? Anyway, so I was referred. It was really a terrible time. This was 2010 by then. And I realize now I don't do any more of these cases because I acted with an open mind like a scientist. And the court is antagonic. You have to beat your other side, which is your enemy. So actually the court is not prepared to listen to science, or not prepared to debate science. Therefore, I'm not prepared to work with the court in controversial issues. But what happened later was much more interesting, because although, yes, I was referred to the GMC in 2010, my license was put at risk. Dr. Squire was removed from the GMC, was struck off. Dr. Scheinberg was referred to the Human Tissue Authority with allegations that she has used tissue with no consent. And this was all Scotland Yard and the Crown Prosecution Service. And how we know this? Because there is an organization in America called Innocence Project. I don't know if you have heard of it.
I have not, unfortunately.
Okay, Innocence Project is a project run by universities in which professors, well-known professors, will work with the students as for the defense of cases where they believe there has been a miscarriage of justice. So they will only take cases when they believe it's been innocent. That's why it's called Innocence Project, and it's free. It's free, it's
Right.
expertise for the students, and at the same time, they are guided by well-known professors and experts in the field. So there was a meeting on shaking baby in America. Maybe then it was 2011. It was 1 year out after, but my case was still ongoing. And I was with restrictions in my license, so I couldn't do medical legal cases, for instance. And I felt horrible. I felt hurt, really, you know. One of the leading solicitors or lawyers from this project went as an attendee to this project on shaking baby. And there was a presentation from Scotland Yard, who very foolishly presented how are they doing to win these cases in the UK. They say, and she was making notes of, and I have all her notes. She was very kind, she forwarded us to us. And they say that they have set up a plan. They met with police, Scotland Yard, Crown Prosecution Service, and experts for the prosecution, like forensic pathologists, neuropathologists, eye pathologists, pediatricians. And they designated this plan, which included looking to the past of these experts with a thin comb. They use this word, so I'm sure they went through my immigration papers. Speak to the judges through the back doors. They listen and discredit them. So it was a very long meeting, and with that, I went to the Freedom of Information Act, or my solicitors went to the based on the Freedom of Information Act and asked for the minutes of that meeting. And it came something like 10 pages. They was all redacted. So I couldn't see anything because it was all redacted. However, the minutes were 10 pages. So the meeting happened, and it was a long minute meeting. So after that, I decided that it is really, the system is not prepared to listen to differences, controversies. So they only want to listen one thing, and it's dangerous. It's dangerous because it's your livelihood. I started taking antidepressants at that stage because I was so affected, and they don't have the right to do that. However, all these things made me stronger, and I don't have any problems to speak up. I have all the issues from the GMC. My license was I got it back clean, but it's not nice. And now I'm just finished yesterday a chapter for editors, and then okay, I was saying that now I don't do these cases anymore for the defense. I was happy to attend some Innocence Project exercises recently when they presented cases to me, and actually the case they presented last week, they were asking me as an expert in order to take or not the case. And I say, because of ABC, this looks non-accidental injury. So I really don't take cases on sudden or shaking baby syndrome, but it's very sad because these cases, there are no experts that will take the cases because your license is at risk. So, but what I do is I write, or I do presentation if they invite me, about non-accidental injury, in which you have clear non-accidental injury, possibly non-accidental injury, and this kind of controversy. So I would go through, the whole spectrum. But now Wayne Squire, who is the doctor who was struck off, but then she was restored, but she now retired. She's co-editor of a book with people from Sweden, who, I don't know if you're aware of the Swedish Report, but it's something I advise you to read, the Swedish Report on Shaking Baby, which they actually made a review, and they disauthorize all the most literature on Shaking Baby. So some of these are the co-editors and some people from the States. And my chapter that I just finished yesterday was to describe the epidemiological similarities between sudden infant death baby and shaking baby, because they are both usually males, usually less than 6 months, usually vulnerable poor families, usually mother smokes, usually high pregnancies, usually preterm, or more frequently small for the gestational age. And one of the differences is that the babies of sudden infant death will be found dead in the morning because they die during the night. But the babies that die during the day, if there is a witness collapse, like a sudden infant death while awake, they will be resuscitated. If resuscitation is successful, then some babies will present a triad, and then that adult will be the perpetrator.
Okay, Marta, and as a final question, I would really like to ask you, obviously very well known for your work and your study in terms of sudden infant death syndrome. Could you please elaborate more on that? I'm quite curious to learn more.
Yes, okay, that's it. How can I say, assembled perfectly with the previous question, because I just finished saying the similarities.
Yes.
Okay, sudden infant death is the sudden death of an infant in which we don't know the cause after having done a complete and thorough postmortem, having done a home visit with a scene examination and having collected all the family history, and we don't find the case. More and more, these cases are reducing because we are knowing what is causing, and we are putting different names. So sudden infant death is still the leading cause of death in the developed world. In Africa are the infections, but in infants, the leading cause of death is sudden infant death. And is a way, an elegant way of saying negative postmortem. We don't know why this infant died. However, we know now that sudden infant death is the end result or common result of a combination that is well described. It was in 1994 described by Filiano and Kinney. It's called the triple risk model. So you have the combination of a child that is going through a developmental period that is usually an infant. Peak age is between 2 to 4 months. That sometimes has been premature, has been small for the gestational age, that has some vulnerabilities. So that's the second element. One is the developmental period, the other is the vulnerabilities. So the child, the infant, can have such genetic predisposition, may have arrhythmias that have been undiagnosed, may have abnormalities in the way that the mitochondria or the body builds up the cellular energy, may have smoking during pregnancy that affects the breathing, may have failure of the auto-resuscitation reflex, failure of the breathing, failure in the brain stem. Is very, very, very complex. And then there is a stressor. That's the other element. So vulnerability, developmental period, stressor. And the stressor may be having a cold, maybe winter, maybe put prone. And why babies that sleep prone have more risk is because when the babies have too much carbon dioxide, they will gasp. They will have a site, they will gasp. They will auto-resuscitate. But if the baby's face down and there is a failure of this auto-resuscitation reflex, the baby will pass away and will die. So, but some other babies, I have done some years ago a research in, we know that babies that die with SIDS frequently have a cold. Why? And then it's interesting because we study the inner ear of these babies in a small group, no, with consent. And we found that in one case, we had died of SIDS, had an upper respiratory infection, and the infection of the virus was around the auditory nerve in the ear. And that nerve is connected with the brainstem. So that may be why a virus, if it gets to the nerves in the ear, may get to the nerve as well in the brainstem and trigger death. So it's very interesting, but we have been able to reduce sudden infant death, the incidence of sudden infant death. Because, for instance, put the baby to sleep on their back, don't go sleep with your baby if you are with alcohol or you have consumed drugs, because other risk factor, stressor, is the hyperthermia. Babies don't tolerate well the hyperthermia, and being in contact with another adult body, being under an adult duvet that is very thick, may actually trigger sudden infant death in those babies that are vulnerable. But we don't know when the babies are vulnerable until the death happens.
Oh, marvelous, and I think it's quite remarkable, you know, the extent of knowledge you received from, you know, people like Roc Kaschula in your time, and how he pushed you to become a trainee, and how your background with your family and boyfriend, your ex-boyfriend, has led you into this field of medicine, and how you know, proceeded on to, you know, testify in court, give your scientific opinion, your professional opinion as a doctor, and how you know, from there on, it affected you mentally because your license was on the line. I think, and going on to receiving the OBE award as well. I think, you know, if you're concerned about leaving enough behind for people to remember, I definitely think you've done that in abundance, in my opinion, Dr. Cohen.
Thank you.
But
thank you.
And me and Brendan, we are so grateful to have you on the show. We appreciate you for taking the time there in the UK to dial in and have a nice little conversation with the two of us. You know, we definitely think that we'd like to identify with our guests in various manners, and just thank you again. We're so appreciative.
Thank you. I want to tell you that there was no time for this, but my life has changed during the pandemics, because I became an influencer in Argentina about the pandemics. And like, I open an Instagram and I have 118,000 followers in a year, and I'm writing a book. I'm writing a book about all the pandemics, and it's also a bit of biography, and it tells about South Africa and my life. And I think every challenge make you stronger. So the important thing for me is to tell, you know, you have challenge. Life is not easy. You have moments of happiness, enjoy them, because there are moments, but life is tough. So, you know, don't give up, and always put the other face, because you will survive and you will be stronger.
Exactly. You keep persisting.
It truly has been a wonderful interview. Thank you so much, Marta. I think finally now we expand our audience now to some South Americans as well, as we don't have any South American listeners yet. So I'm quite excited for that, as we find some more borders on our show.
Yes, I am happy to put this into my Instagram, my YouTube, etc. So people can listen. Yes, that would be great. Absolutely, and thank you for having me with you. And you know, I don't know how you identify me, but I am very honored.
Thank you. We were truly humbled. You are truly an inspiration, and it was truly a pleasure talking to you. Thank you.
Thank you, and stay safe.
Thank you. You too, Doctor.
Bye. Bye.